All right, Chapter 5, Special Phlebotomy Procedures. And this is our last chapter. Bleeding time, that's a special test we do. And it's pretty much exactly what it says. We're going to see how long it takes for you to stop bleeding, really. And it's called bleeding time. Or your platelet function. It tells us how good them platelets are working in your body. The function is to prevent blood loss due to injuries or wounds by releasing factors that promote clotting of blood and coagulation. I want y'all to get clotting and coagulation in your head together. Those two mean the same thing. What test tube, we're probably, if we're drawing that blood, what tube we're going to put it in? Blue, 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 blue. Anything coagulation goes in that blue tube. Give me some give me some examples. There you go. PT, that's partial thrombastin. Remember, thrombos and platelets are the same. Y'all had that, y'all did very well on your terminology, so just make sure you, when you're thinking of answers and questions, just go back to that. Y'all did real good on that test, so come back to that. Underline, a normal bleeding time is between 2.5 minutes and 9.5 minutes. Underline, that's normal. So if you're not bleeding within those ranges, if you clot up too fast, then we need to give you some blood thinners. If you're bleeding longer than that, they got to give you some clotting factors. And there are people with hemophilia, you'll see that again, that don't have those clotting factors, and they can bleed to death on you. So you have to watch your hemophilia patients. Causes for lasting or prolonged bleeding time: platelet disorder, fibrinogen disorder, aspirin. Did y'all know aspirin thins your blood? That's why they say if you suspect you're having a heart attack or stroke, what do you take? Bare aspirin. And some people just take it anyway just because they just don't want to have one, period. Every day people take that aspirin 85. Aspirin, take the 80, not the, I think you can take up to 365 if you've already had a stroke or if you've had clots. But you want to take an 80 for maintenance. The older you get. And I'm going to, I need to start. I don't want to, I don't want that.
You ain't gonna be with your stomach?
Aspirin, not so much, but any medication you need to eat because it will, things do mess with your stomach. But yeah, a lot of people do aspirin as just prevent maintenance. And scurvy, underline and remember that. Scurvy can cause irregular bleeding time or prolonged bleeding time. Of course, for alcohol, we're just gonna, for equipment, we need our alcohol sphygmomanometer. What's that? What's a sphygmomanometer?
The cuff that go around on.
The blood pressure cuff. That's that other name. Y'all don't forget that. Because some people be funny and like, bring me the sphygmomanometer. But that's, but y'all know this, the blood pressure cuff. Bleeding time device and a stopwatch. You pretty much is gonna cut this person for the test. And what we're trying to do is see how long it takes you to stop bleeding, which is crazy because we're going to watch it and blot it and look at it until you stop bleeding. And that is the most oldest test that they've done that we do. Always remember that prolonged bleeding, if they're on any NSAIDs, that also thins your blood. NSAIDs, non-steroidal anti-inflammatory drugs, will also thin blood as well. Not as much as aspirin, but they kind of like, they dealing in the same family, do the same kind of things. The procedure: make sure that you're going to place the sphygmomanometer on the upper arm. Check the site, make sure there's no scars, exposed veins. If they've got too much hair, we're going to move that to clean selected site with alcohol. How long are we going to let it dry? 30 to 60 seconds. How long does it take alcohol to dry? 30 to 60 seconds. Well, how long? And it just says right there, inflate the sphygmomanometer to what millimeters per mercury? That's what that stands for. 40. mmHg just means millimeters. Hg stands for mercury. 4 millimeters of mercury. And make sure it stays at that number as well. Place the site parallel to the antecubital crease and apply tight pressure. They're just saying put it on there. push the device trigger at the same time as the watch. It's going to look and remind you of a finger stick. That's all we're doing. It's just like a finger stick. But it's bigger. It's a whole cut. But it's just the thing looks like a finger stick. And they're gonna cut you in a good size, better. It's not a poke, it's a cut. And that's how it goes. And then you take that little thing, and it's like a lancet, just like your finger stick. It's got a needle in it. Or this is more like a very, very, very small blade. Very small. And we toss that in the sharps container. That's where those go. We won't be doing those as well. We're not going to sit there and watch nobody bleed, but you may do that in the hospital setting or doctor's office, whatever. You may have to do that, but they'll have those devices. Okay. Dispose of device in the sharps container. Begin timing. As soon as you press that device in and I want to say it's a cutter, but they don't want us to use that word. But as soon as you press your device, press also the stopwatch, and you're going to start watching the time. Blot the blood flow by using filter paper after 30 seconds, and then every other 30 seconds. You're going to keep on 30 seconds, 30 seconds, 30 seconds. If it continues for more than 15 minutes, stop timing, apply pressure, and record. And what was our numbers we needed it to be in? What is our normal bleeding time?
2.5 to 9.5.
That's it. That's it. Next test, blood alcohol testing. It is the same as we are doing, just as we test for anything else. But guess what you do not use if you're testing for alcohol? What do you not use on the site?
Alcohol.
Alcohol. You use betadine, iodine, something, whatever your facility supplies, but no alcohol, because that kid erroneously put somebody positive when and they don't need to be. Also, underline the highest level of alcohol in the blood is present about 1 hour after having an alcoholic beverage. So where's your highest level? 1 hour. And then it goes away. It's kind of like your alcohol level goes up, it goes down. Underline that next sentence as well. The majority of alcohol will be broken down in the liver. Where is it broken down in?
The liver.
And the remaining alcohol is passed out by exhaling and urination. Underline that. So how do we expose of the remainder of the alcohol?
Exhaling and urine.
That's why they do a, what do we call it? Breathalyzer. Because this alcohol coming out, and we breathe it out, but not the stomach. Just remember, you're gonna see a question. It says something about the stomach. Don't choose stomach, or not the stomach, I should say. The procedure, just same thing, but clean the site with non-alcoholic solution. Underline that. Just remember that. That's what's different. That's the only thing really different. Just clean it with non-alcohol. Up under the procedure, underline clean site with non-alcohol solution. That's really it. That's your main focus there. And remember about the highest level is 1 hour. Blood donation. A phlebotomist may also perform specimen collection in blood donation facilities. And a lot of y'all coming straight out, they like to hire you at blood donors. Then you kind of get experience. But they like to hire newbies. We call them newbies. You won't probably, if you're a phlebotomist, you won't get hired like night shift. They don't want you to be alone in the beginning because you are responsible and you don't have nobody to talk to, call to. You are the boss, phlebotomist. So they want you to know what you're doing. So and that's a good thing. You may just automatically go to day shift so that you can ask the experts, you know, people that's been doing it. Give me a little hint. Give me a little clue what you do. And you learn like that. That's how you learn nursing too. You ask questions and people give you their experiences. It just comes to you like that. But blood donation centers, you might have to do that. You got to make sure it's labeled correctly. We already know label, label, label. Make sure you ask that person what is their name. Don't tell them their name. Always, even after the draw, I let them see the tubes that I label them and ask them, is that your name on that tube? Yes, ma'am. Okay. Because when the blood gets mixed up, it gets mixed up. And sometimes they'll print out a label. It'll be in the wrong chart. You just pull a label. Just stick on that blood. You just draw real quick like. And then you done labeled it with the wrong label. So that's where I did. And that's what a couple of my nurse friends have done. It just have to be labels. They print it out. That have to be in the chart. Wrong chart. You took the labels because, you know, that's the easiest way to label it. Get their stickers. And label the wrong person. And you can mess up somebody with like that. But to be a donor, you must be 110 pounds. Underline that. They ain't 110 pounds. We don't want their blood. They ain't got much to spare. They got to hold on to their blood. And that's real. The smaller you are, is actually bigger people got bigger veins, bigger arteries, bigger, just because, you know, he's got to go through things. And those are actually the best ones to donate. You have to be between 17 and 66. If you're anything else, you got to have your parents' permission. Autologous donations. What in the world is that? That is you donating your own to your own self. That means you might have surgery in a week and you want to donate your own blood. And some people, Jehovah's Witnesses are bad. They're not bad like that. I don't mean that. They will not accept anybody else's blood because that blood is their soul. They believe, you know, it is the soul, and they don't want nobody else's blood. It just ain't the same. And I always equal it to how you know, how we drink wine. That's Jesus' blood. That was his soul. That was his life. So we drank the wine like Jesus' blood. They kind of took that there. And like your blood is your soul. So they don't want nobody else's soul. So they would probably be not also getting organs. Even though they could save somebody's life, Jehovah's Witness not going to take your organ. Things like that. But especially blood. And you'll see it, especially if you're donating. I mean, if you're drawing blood. That's the most place you'll see something strange about blood. Autologous, underline that first sentence, person donates blood for their own future use. Also know that their level of hemoglobin must be at least 11. If it's not 11, you need blood. You don't need to be donating to yourself. You need some hemoglobin. You need some something yourself. So hopefully you're not Jehovah's Witness. But a lot of people would donate their own blood. The surgical procedure cannot be within 72 hours after your donation. So you got to donate before 3 days of your surgery. Or else we don't, you know, you already lost some blood. You're working your blood. Your blood, you know, just as soon as you lose blood, your blood and body is trying to produce more blood. That's the fact. That's what's happening. Your body says, okay, we done lost some blood over here. Let's produce some more. And your body works like that. But 72 hours give yourself before you have that surgery. Blood donation procedure, 2-step cleaning process. What you normally do, you're going to clean it with alcohol and then iodine or betadine. It's going to be something to process it. You've got to be more sterile with those type of donations because you are going into a very large vein and we're going to be sitting there pulling it for a while. Select your large vein, generally the antecubital area. A 16-gauge needle, underline that. What gauge needle do we use for blood donation?
16.
That's a big one. What have y'all been using? 23, 21, 25, 16. And it looks like a post to me. But I've donated, and that's where I got my little hole right there from donations. But mine was mostly plasma for money. And we go to blood donation centers for that, but they've got a lot of those. Did that in school, high school. I mean, not high school, but college. Job Corps. That's how we made our money. Y'all don't go donate plasma for money.
No.
It's because y'all are in Thomasville. If y'all was in somewhere that had a plasma center next door,
And I'll be,
you know.
but I ain't been there broke, folks.
Oh, we didn't have no money. We was in Job Corps. They paid us every 2 weeks, probably, I don't know, $50, then $100, something every 2 weeks. Something that we needed some money because we wanted to see the movies, go out to eat, and go get a hotel room. We went. We drank a gallon of water before we went in there and donated that plasma.
What they pay?
Yeah.
I mean, what?
Back then it was like $20 a draw. They might do better now. I'm not sure. But to us and being teenagers with nothing, we didn't have no bills. That was like, that's the hotel money right there. And we're gonna go to. If you go the third time, you get even more money. You get like a $15 bonus, like you at work. But yeah, if y'all ever get broke, and it's because y'all don't have a plasma center here. If y'all did, and I was in Albany, Georgia, at that Job Corps, and they would drop us off from Job Corps on the Job Corps bus to the plasma center. They knew we needed some money. But everybody, I love Job Corps. Everybody goes to school, whatever school you're on. I went for printing because in my hometown, they got Avery Label. They make so good money. They don't do a lot of nothing. But them people make as much as nurses. But that was full. They made me take a test. So they sent me to Darden College. Then I went to Albany State and did all my stuff with them. And but that's Job Corps does not mean just those skills there. You can go to college too. You just got to pass their test. As long as you passed high school, you can do it. A lot of people at Job Corps that hadn't passed high school first. They got to get their GED. But I had one young lady quit school in 10th grade. She beat me. She had her master's, I mean, right out of Job Corps. You know, and that was odd because she stayed there long. But she quit school, said she just didn't like school. Don't want to go to school. She didn't like them people, and they made fun of her. She real high yellow, and they banana. It stuck to her, and she said everybody calls me that, and I quit school. Everywhere I go in my hometown, they call me banana. So she quit school and moved and lived at Job Corps till she finished her master's. But that's just my preaching to let y'all know if people, you know, like Army, they can't get in the Army, can't do the Army, tell them to go to Job Corps. You know, it ain't nothing. Go get something. Yeah. The anticoagulant in tubes is the citrate phosphate dextrose. Underline that. For blood donation, the tube used, or the anticoagulant used in blood donations is citrate phosphate dextrose. So what is the anticoagulant?